Bengaluru, 13th March 2025. Bengaluru, chronic kidney disease (CKD) is emerging as a major health concern in India, with a rising number of cases linked to diabetes, hypertension, and lifestyle factors. To address this growing issue, SPARSH Hospital, Nagar, Mysore Road, observed World Kidney Day 2025 by hosting an awareness event with organ receivers. The event focused on prevention, early diagnosis, honoring donors, experience sharing by organ receivers, and the role of kidney transplants in saving lives.
Today, on occasion of World Kidney Day, usually we celebrate World Kidney Day on the second week Thursday of the March. So the theme for 2025 is, are your kidneys okay? Detect early and protect the kidney health. What does it mean is, basically you need to, as we all know, that close to about 10% of the adult population worldwide are affected with chronic kidney disease, and roughly about 1% of these patients goes to something called as end stage renal disease if not detected early stage. So I would like to inform the general public that take care of these 8 golden rules. One is moderate your weight. Second one is eat adequate balanced diet. Okay, don't eat too much of the salt and junk foods. Okay, hydrate yourself adequately, and if you are a smoker, quit smoking. Okay, and if you are a alcoholic intake, you have to moderate your alcohol intake. Okay, and if you are diabetic or hypertensive, check the sugars regularly, keep the sugars under control. If you are hypertensive, check your blood pressures regularly. Okay, by doing all these things you can, and annual health checkup, kidney health checkup is very, very important. By just doing a simple health checkup in the form of a urine routine to look for protein intake, and one simple blood test called serum creatinine, and one simple ultrasound can help us to detect the kidney disease at the earliest and to take care of this. Okay, so take care of your health and be well.
On occasion of this World Kidney Day, as Dr. Arsha told, the theme for this year is, are your kidneys okay? Detect early and prevent your kidneys. On this occasion at SPARSH Hospital, Nagar, we thought we'll honor our donors. Since last previous year, whoever had donated their kidneys to their near and dear ones, we thought we'll just honor them. So on this day, as you can see, we are honoring all of them. In our hospital, SPARSH Nagar, since last few years, we have done numerous transplants. We have done more than 50 transplants, where all the transplants done are around successful. With most of the transplant, both the donors and recipients are healthy and hale, and they are doing well. So on this occasion, what I suggest is, from a doctor's point of view and from the hospital point of view, we should motivate all of them to donate their kidneys. Somebody who is healthy, hale, so if their near and dear ones, if they are suffering from the kidney disease, they should be motivated, and awareness campaign should be done to donate the kidneys. Anybody who is healthy, does not have diabetes, hypertension, and is doing well can donate the kidney. So on this occasion, we are facilitating our donors who have donated their kidney since last 3 years. Thank you.
How many transplants have been done so far?
Last year and this year we have done around 53 transplants. Among this, 46 are live transplants and 7 is cadaver transplants.
Is there any age limit?
There is no age limit for donation. So anybody, as we can see, we have an eldest donor who is 78 years. He donated his kidney 1 year back, and today he is with us. He is doing well. But these donors who are elderly should make sure they don't develop diabetes and hypertension in future, and should be on regular follow-up with the doctors. At least once in 3 months they should be able to get their blood check done in form of blood sugars, creatinine and hypertension check done. Once it comes to recipient, whoever they receive the kidney from the elderly donors or from the near dear ones, they should be able to follow up with a nephrologist regularly.
Doctor?
Then basically with once it comes to transplant, the donor, they don't have any side effects at all. Recipient, they'll be on the immunosuppressive medications, which we tailor down. Means basically we bring down the dose of immunosuppression for a period of 6 months to 1 year. So during this time, they should come to us, visit us regularly, so that they are not prone for infections. Apart from this, there are no side effects with respect to transplant or immunosuppressive medications with the transplant.
Yeah. So once what after post, what is the measure that he or she has to be taking?
They just need to come for a regular follow-up. Once in 6 months, they should get their creatinine, urine routine, and a blood pressure check. That's all. Because as Dr. Harsha told, you would have heard, the persons who donate their kidney, they live long. Because at the time of workup, before donation, we would have done all the blood tests. Once, though the patient are giving kidney, we check their heart, we check their liver, we check their all the parameters. Like if it's women, we check their uterus, so their breasts, like we get a mammogram, everything. All the workup. When it comes to men, we check their prostate. We make sure they are physically fit before the transplant. So if they are fit, then only we consider them from the transplant. And once they donate the kidney, they become ourselves aware of their own health, and they'll be able to follow up regularly. In fact, we have a eldest living donor. Means she donated her kidney 14 years back to her husband. Both of them are hale and healthy now.
Please.
ಈ ಅಂಗಾಂಗಗಳ ದಾನಗಳು ಭಾಳ ಒಳ್ಳೆಯ ಕೆಲಸ. ಇದಕ್ಕೆ 3 ಸ್ಟೇಜ್. ಮೊದಲು ಜಾಗ್ರತೆ ಮೂಡಿಸ್ಬೇಕು, ಆಮೇಲೆ ಎರಡನೇದು ಮುಂಜಾಗ್ರತೆ ಬೇಕು, ಮೂರನೇದು ಚಿಕಿತ್ಸೆ ಬೇಕು. ಜಾಗ್ರತೆ ಮೂಡಿಸ್ತಕ್ಕಂಥದ್ದು ಭಾಳ ಮುಖ್ಯ. ಡೊನೇಷನ್, ಆರ್ಗನ್ ಡೊನೇಷನ್ ಮಾಡೋ ಮುಂದೆ ಬರ್ತಾರೆ. ಆಮೇಲೆ ಯಾರಿಗೆ ರಿಸಿಪಿಯೆಂಟ್ ಇರ್ತಾರೆ ಅವ್ರಿಗೆ ಉಪಯೋಗ ಆಗ್ತದೆ. ಇತ್ತೀಚಿನ ದಿನಗಳಲ್ಲಿ ಟೆಕ್ನಾಲಜಿ ಭಾಳ ಬೆಳೆದಿದೆ. ಆದ್ದರಿಂದ ಅಂಗಾಂಗ ದಾನ ಮಾಡೋರಿಗೂ ಒಳ್ಳೆಯದು, ಏನು ತೊಂದರೆ ಆಗೋದಿಲ್ಲ. ಯಾರಿಗೆ ಪಡ್ಕೊಳ್ತಾರೆ ಅವರಿಗೂ ಒಳ್ಳೆಯದಾಗ್ತದೆ, ಉತ್ತಮ ಜೀವನ ನಡೆಸೋಕ್ಕೆ ಬರ್ತದೆ. ಆದ್ದರಿಂದ ಈಗ ನಾವು ಜಾಗ್ರತೆ ಮೂಡಿಸಿ ಹೆಚ್ಚು ಜನಕ್ಕೆ ಪ್ರಯೋಜನ ಮಾಡಬೇಕು. ಈಗ ತಂತ್ರಜ್ಞಾನದ ಸಹಾಯದಿಂದ ಕೂಡ ಈ ಕೆಲಸ ನಾವು ಮಾಡೋಕ್ಕೆ ಬರ್ತದೆ. ಭಾಳ ಸಂತೋಷ. ದಿನಕ್ಕಿಷ್ಟು ಈ ಕೆಲಸದಲ್ಲಿ ಜಾಗ್ರತೆ ಮೂಡಿ ಹೆಚ್ಚು ಜನರಿಗೆ ಪ್ರಯೋಜನ ಆಗ್ತದೆ. ಇನ್ನೂ ಭಾಳಷ್ಟು ನಮ್ಮ ದೇಶದಲ್ಲಿ ಆಗಬೇಕಾಗಿದೆ. ಎಲ್ಲರಿಗೂ ಒಳ್ಳೆಯದಾಗಲಿ.